For changing the non-sterile dressing, you'll need a biohazard bag, some tape. For our demonstration today, we're going to use paper tape. Some tapes will require scissors, but the paper tape does not. Whatever you're using to actually cover the wound, and then your gloves. You're going to start by washing your hands, and then you'll put on your clean gloves. To remove the bandage, lift up the corners, pulling the corners towards the center of the dressing, and then lift the dressing off. If the dressing is stuck, you will need to let the nurse know that. You wouldn't want to rip the dressing off. Okay. You're going to dispose of the dressing into your biohazard bag. Remove your gloves. Wash your hands and apply a clean pair of gloves. Your dressing should extend about 1 inch beyond the wound. So this would be fine. This would be a good size for a wound of this size. If the wound were longer, you could get a larger dressing, or you could open this dressing up and put a couple of layers on top of it. Put your dressing in place, and then, as I said, I'm using paper tape so it doesn't require scissors. For a non-sterile dressing, you want to just tape 2 sides of the dressing. You want some air circulation on the other 2 sides. If it were a sterile dressing, you would need to cover all 4 sides, but Nurse Aid 1s don't do sterile dressings anyway. Some facilities will have you put your initials or the date on the tape or the dressing. If I were going to do that, I would need to write that on the tape before I put it on the patient. You don't want to put the tape on the patient and then be pressing down with an ink pen. But for our demonstration today, we're not going to date it or put initials or anything. Then you're going to remove your gloves, again without contaminating yourself. You would put your supplies back in their proper area, wash your hands, and your skill would be complete.